kondisi Barret Esofagus yang sudah berlangsung lama dapat menyebabkan kanker? Simak penjelasan Dr. Melissa Teo berikut ini.
Yeah, no, like what Dr. Tan has said, Barrett's is something that we have to keep a follow-up on, because Barrett's actually is almost like a precancerous condition. So in patients who have a lot of reflux disease, which typically happens if they drink a lot, take a lot of fatty meals, have poor digestion, and sometimes they have this hiatus hernia. It predisposes to reflux. Then the esophagus gets exposed to the acid that's formed in the stomach and undergoes the changes that Dr. Tan was talking about, and that definitely predisposes to cancer. So a patient with Barrett's will have to remain on lifelong follow-up to try to ensure that if any cancer develops, it is picked up early, and that the appropriate surgery should be done as soon as possible.
Oke, jadi ini adalah pertanyaan selanjutnya, Barrett syndrome itu apakah menyebabkan kanker? Dijawab ya oleh Profesor Melissa Teo. Jadi Barrett ini sebenarnya adalah kondisi kita sebelum kena kanker sebenarnya. Jadi kalau kita perhatikan sebenarnya kalau kita ada Barrett itu harus hati-hati. Karena jangka panjangnya kita harus melakukan monitor secara dekat ya. Jadi Barrett ini memang harus diamati dan diambil sampelnya setiap waktu. Kita harus tahu persis apakah kanker ini akan timbul dari kondisi.
Kanker perut tentu saja berbeda dengan tumor dan kista. Nah, bagaimana ya cara membedakan antara kista, tumor, dan kanker? Apakah kista selalu tumbuh di dalam dinding rahim? Berikut penjelasan lengkapnya oleh Dr. Melissa Teo.
There are a couple of common conditions, and when you say cyst is a very generic term because cyst can mean a lot of things. I think what the person means to say is usually you refer to tumor, and the tumor can be cancerous or non-cancerous. So patients can have polyps in the stomach, and polyps in the stomach are quite common, and most of the time the doctor will explain to the patient and say you have some cyst in the stomach. Actually, it's not cyst, it's polyp. But the polyp in stomach usually is not dangerous like polyp in the colon. Polyp in the colon, like what Dr. Tan has explained, needs to be removed because polyp in the colon has a higher chance of changing to cancer. Polyps in the stomach most of the time will remain the same size for many years. And yeah, every now and then you can put a scope in to have a look. And when I do a scope and I see some polyps, I usually biopsy the biggest one to test to make sure that there's no cancer, because you were asking me how do you know if it is cancer or no cancer. And so we will biopsy the biggest one, and generally speaking, if the biggest one is negative, the rest are okay. There is another condition known as GIST, not cyst, but GIST, gastrointestinal stromal tumor, GIST. That is a tumor usually in the stomach, and interestingly, it is not inside the stomach, but it is usually in the wall of the stomach, and sometimes it comes out. When we do a scope, we may not see a tumor. Sometimes we will see just a very interesting ulcer. We call it umbilicated, but that is a medical term. All right, when we see that, we are very suspicious. Or sometimes we do not see a tumor in the stomach, but we see that there is a bulge. There is a little hump in the stomach, and we suspect that maybe the tumor is in the wall of the stomach and on the outside. So in patients where we have this suspicion, we will ask the patient to go for a CT scan. And the CT scan will be able to show us the tumor that is in the wall and on the outside of the stomach, even if it cannot be seen on the scope.
Oke, jadi sobat saya rangkum ya, pertanyaan yang bagus sekali. Apakah kista perut itu berbahaya dan bedanya apa dengan tumor? Dijawab oleh Prof Melissa, sebenarnya kata-kata kista itu kalau di perut tidak ada, adanya adalah polip. Ya, jadi kebanyakan mungkin yang dimaksud adalah polip. Jadi polip ini beda dengan polip yang ada di usus. Polip perut itu biasanya tidak berbahaya. Kalau di usus pasti akan jadi kanker. Kalau polip di perut biasanya ya nggak apa-apa dan ukurannya sekian aja. Dan ini biasanya bertambah banyak dengan berjalannya waktu. Nah, kalau kita ditanya apakah polip ini berbahaya atau tidak, Prof Melissa menjelaskan bahwa biasanya cara dia simpel sekali, kita masukkan endoskopi, kita ambil sampling dari polip yang paling besar ukurannya. Dan biasanya kalau ukuran yang paling besar itu negatif, yang lain biasanya nggak apa-apa. Seperti itu. Ada jenis lain yang dijelaskan oleh Prof Elisa, ya jenisnya namanya GIST, ya, GIST, itu adalah sejenis tumor jinak yang kalau berkembang itu ke dalam, bukan keluar dari dinding perutnya, nanti keluar dinding perut. Nanti di dalam biasanya ada perubahan warna atau seperti ulcer, seperti itu. Jadi ketika dokter melihat itu biasanya akan dilakukan cek label lanjutan lagi. Dan kadang-kadang ada beberapa kondisi yang ada lam, jadi ada seperti benjolan besar di dinding kita. Kalau itu terjadi, biasanya Prof Elisa akan melakukan namanya CT scan, akan memastikan bahwa benjolan itu tidak berbahaya.